Have you ever dealt with hip pain, in particular on the side or kind of the back of your hip? And oftentimes you've got maybe diagnosed with just a hip bursitis. Unfortunately, the hip bursitis diagnosis is typically just a blanket diagnosis when there's no hip joint issue and they really can't figure out what's going on, just give you a bursitis diagnosis. But it doesn't really, solve your issue. And unfortunately, a lot of times, a lot of other doctors don't have a great treatment protocol for this type of hip issue. And what we're going to go over today is actually something called Gluteus Medius syndrome, or sometimes we call it dead butt syndrome, which is a trigger point or a muscular dysfunction of the glute medius, which sits right on the side of the hip there. And it really acts as a hip stabilizer during single leg stance. Anything from walking to running to golf, tennis, basketball, all these different sports that we play, the glute medius plays a huge role in stabilizing the hips. And when your hips don't stabilize, you can end up with issues with knee because it's the reaction site. So if the hip isn't stable, you're going to get a little bit of dysfunction in the knee. You could also lead to back problems as well. And so the glute medius syndrome is common. There's other areas in the hip that can be painful that's not glute medius syndrome, but we're going to show you that today in our evaluation and treatment of this common trigger point that we see in the hip. The good news is in our practice, we can evaluate, get you a distinct answer of what it is, and we have some treatment solutions for you, and we're going to show you that today. Whenever we're evaluating a sports injury like, say, gluteus medius syndrome, we're going to run the patient through a full functional assessment and check the biomechanics. We're looking for weaknesses, tightnesses, movement pattern issues, and so we're going to go head to toe on that. In this video, I'm going to show you 3 different things we look for as it relates to the hip. And from there, it's going to give us an idea of what may be causing it. And we'll pair that up with our evaluation as well. So we're going to go through a few tests. Go ahead and face me like that. I want you to go feet together and go into a full toe touch for me as far down as you can. Okay. So with Tito, he's a little limited on the toe touch. So we know there's something going on in the calves, hamstring, low back. You can come on up. That's not allowing him to go all the way down and touch his toes. So we'll figure that out a little bit more on the table and give some corrective exercises to work on that because that's going to really help with that whole posterior chain. Second one I want you to do is standing like that. Pick one leg there. We're going to do this on both sides. I want to see how the hip is stabilizing there. Sometimes we'll see someone shaky. We'll also sometimes see them drop down like this. That's showing that hip is not able to stabilize on a single leg. Good. Let's do the other side. Perfect. And sometimes we want to see if there's a left-right asymmetry. It's a little shakier on that left side than the right. And I just want to see how it is. Now I'm going to go a little bit more advanced and I want you to give me 3 little mini squats. I want to see if he can do that controlled, because if he can't, we know that's going to creep into his activities and potentially put a lot of strain on that hip and the knee. Good. We'll do that. And then we'll do the other side. A little bit tougher on that side. The knee is actually caving in a little bit. So I noticed on him there's a left-sided dysfunction in the hip, and we would want to address that through some treatment and exercise. Okay. And then lastly, we're going to do an overhead squat. It's a little bit different than squatting in the gym. I want your feet shoulder width apart, pointing forward. Good. And I'm just going to have you cross the arms and go all the way down into a full squat as far as you can. Good. He does a good job. He can go all the way down and come back up. A lot of people struggle with that, and we also are going to look at a bunch of different things. I could shoot a whole 10-minute video on the squat at some point. I'm sure we will. But we're going to look at that to see how the hip is functioning in movement, and that's going to clue us off and lead us into our evaluation. Once we have diagnosed someone with gluteus medius syndrome, our doctors here are certified in active release techniques, which is a great muscle therapy. And as the name implies, it's going to be active. And we're going to get in there and really release that trigger point, restriction, scar tissue, anything that we find in that area. And so what I'm going to have you do is I'm going to get in here. We're getting a thumb contact on the trigger point. And then the patient's going to actively go from a straight leg here. And then I'm going to have you bring that knee all the way up the chest. So go ahead and do that for me as far as you can. 5 good times. I'm going to really get into there, get some good tension on it. You feel that? Yeah. and we're going to release that trigger point. So this is the active component of it. It's different than massage therapy. We're just kind of rubbing tissues, which is great for a lot of things, but we're going to get in there and really actively release that trigger point. All right, give me one more there. Good. And then I'm also going to do some active release in this QL muscle here, because a lot of times it's connected. When we get dysfunction here, it tends to chew up the low back. And there's a muscle right there called the quadratus lumborum. You feel that right there, a little tight on you? And so I'm going to get onto there, and we're actually going to do the opposite movement. I'm going to have you hold on to the table with that hand. We're going to start the leg here, and then we're going to bring it back. And then I want you to really drop it all the way down like that, and you'll feel that release there. So go ahead and do a few of those for me. I'm going to get on that. Good. And we're really, if you ever feel tight in your low back, this will really release that and help you out. Good. And sometimes some people call it a good hurt. Good. Two more. Good. And one more. Perfect. So that's just two examples of active release techniques on different muscles. We typically will run different moves on different areas, find all that, and usually 8 to 10 minutes of some muscle work in there and really try to release that. Then we would follow it up with any joint manipulation in the pelvis if we find restrictions there, and also some rehab exercises, which we'll show you now. The next exercise we're going to do is called the airplane. I want you to first make sure you can work on just a nice single leg stance. If you recall during the functional assessment, we test this to see if you can do it. Now, if you're okay with this and you've worked on it and it's improved it, we're going to advance to the airplane exercise. That's really going to help challenge and improve the stability of your hip. Go ahead and get into a single leg stance for me. Good. Like that. And then we're going to get the arms out like an airplane there. And then from there, once you've gathered yourself and you got the stability going, you're going to just rotate the upper torso. Good. To the right. And then you're going to come to the left. It'll be tricky at first, like it is for Tito right now, but you'll get much better on it. Good. And it's really going to challenge the hip muscles to really fire and stabilize. Good. And relax. Even if you work out regularly and really strong on a squat or a deadlift, challenging the intrinsic muscles like this will really help with the overall stabilization. And that type of exercise takes those big global muscles out of it and challenges more of your stabilizers. We're going to show you a really specific exercise that's going to target the glute medius here. It looks very simple. After you do it for a little bit, you'll really feel it wake up that muscle group there. And so we're going to get into this side lying position here with the impacted hip up, knees, feet right stacked there. And all it's going to be is a simple separation of the knee. You really want to make sure your feet stay there, and I don't want you to sway back and forth with the hip, right? Make like almost if there was a stake driven in there holding that hip there. What I want you to do is slowly separate the top knee from the bottom. Good. And come all the way up until you can't. I don't want you rotating back like that. So you just go up as high as you can without rotating that pelvis back. And then you're going to come down slowly as well. Okay. So we want to make sure it's a nice controlled. You can go just a little bit faster for me, but it's nice and controlled. After you do about 8 to 12 repetitions of that, you'll start to feel this muscle group here wake up a bit. And this is a great exercise. It's a beginner level exercise that you can do to start working that muscle group and improve your hip stability. Just like that. One more. And you would do both sides even if you're only having an issue on one. Perfect. If you'd like to get your sports injury evaluated and treated on the same day, call our office at 561-997-8898 or visit us at www.healthfitchiro.com, and we'll get you on our schedule and get you on the road to recovery.